China, the epicenter of a potentially deadly virus.
The concern, of course, how to stop it from spreading.
Health officials here in the U.S. moving fast to prepare for what the CDC has called an inevitable spread.
There are now 57 cases of the coronavirus in the United States.
The emergency room is overwhelmed.
Fatality ratio hovering around 2%.
One group facing unique challenges around this outbreak is America's poor.
Unsheltered, homeless people left on the streets amidst this pandemic.
I promise you, they're not ready for corona.
We have 108,000 unsheltered homeless individuals in the state of California. We need to meet this moment aggressively.
Homeless men and women are particularly at risk because they don't have a place to quarantine or shelter in place. You can't carry out any of the universal precautions. Hand washing, sanitation, all of those things are really difficult when you're living in congregate camp-like settings.
We got parks that are shut down, no restrooms. We got businesses that would let people use the restroom, no longer public access to restrooms. That right there is dramatic, it's huge.
There are some clients that are very fearful due to the fact that they don't have anywhere to go when they're out in the elements.
Every service that they could possibly access stopped. There weren't any church groups delivering food on the street. There was no one offering showers. Everything shut down.
COVID-19, it changed a lot because us that's homeless, we got a real bad chance of catching it. We're out here, and it's like, man, we're scared.
Right now in the emergency response, the goal really is to protect people who are experiencing homelessness from dying or from being infected, to protect frontline staff from being infected, and for them to be able to continue to do their work, and to reduce inflow into the hospital systems so that those resources are reserved for the people that need them the most.
Feels like the Hunger Games of like who has surgical, who has latex, who has non-latex, who has N95s and sanitizer, and how do we get that and then move the product out to who needs it. And so the last week or so, that's actually been happening in my garage.
We're working nonstop, very long days, and a lot of crisis-driven work. Everybody that we have here is super sick.
The coronavirus is spreading through LA's homeless population.
At the Union Rescue Mission, one worker has died of COVID-19. 3 more people living inside have now tested positive.
Homelessness is defined by the scarcity of a home or lack of a place to go. And so the way we've always solved it is by putting a lot of people together, right? With this, you can't do that. You have to do the exact opposite.
You've got hundreds of people in the same room together. It's not individual units. So if someone is asymptomatic but positive and people don't realize, then it's very easy for that to spread very quickly.
This is San Francisco's Division Circle Navigation Center right now. The beds are still within inches of each other. There's no soap in the bathrooms and no towels for people to shower with.
It's very dirty. It's unsafe.
We got word today of a new outbreak at San Francisco's biggest homeless shelter.
68 members of the shelter, as well as 2 staff members, have tested positive for COVID-19.
Chronic homelessness has a mortality average rate of 47 years of age. Lots of respiratory, lots of underlying health conditions. This is going to be deadly for people. And I think that the risk of it spreading, if people are not able to distance, it's catastrophic.
If you think this is just about unhoused or homeless people, you've got it wrong. People who are unhoused and homeless interact regularly with people who are not. And the potential for this to spread from large crowded shelters to the street, to people who are housed, to impact people who are close to you and me and who we know is huge.
The city says it's now trying to move more people into hotels, starting with the most vulnerable.
I'm pleased today to announce a milestone with Project Room Key. 10,974 hotel rooms have been procured. 4,211 individuals are now inside off the streets.
The hotels mostly have people who are older, so you're looking at a lot of people in their early to mid 50s who have experienced chronic homelessness and have aged a lot, and their health conditions are very prevalent. We're hoping these hotels are something that we can use to try and slow that down.
I got a phone call saying, we have a room for you. Can you pack up and can you move in on Monday? And I was like, what?
Our hygiene is better. You know, we got running water, hot showers. We got a bed to lay in, and it's been a stable situation.
Unsheltered homelessness was a crisis before COVID-19. It is a heightened crisis during this epidemic. And if we do our part now, it could be less of a crisis as we come out of this.
There is a sense of urgency. There is a clear need here that isn't trying to convince people ideologically whether people deserve to be housed or not. It is actually the response that is mandated in every community. And so we would be foolish to not leverage this moment to solve this problem. Can we exit people from the temporary solutions right now into permanent housing rather than saying, great, you're not symptomatic anymore, now go back to the streets?